Hello, I'm Dr. Elliot Hirschhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic health conditions like thyroid disease. In this video, I'm going to discuss why thyroid medications don't work and in many cases may be making you worse. One of the most frightening truths about thyroid medication is that most thyroid sufferers don't know is that in many cases medications don't work and can actually be making the problem much worse. The first problem with thyroid medications is that in the vast majority of cases, the medication does absolutely nothing to address the underlying physiological causes that are driving a patient's thyroid dysfunction. Most hypothyroidism is caused by an autoimmune disorder called Hashimoto's disease. This means that the problem is with your immune system attacking your thyroid, not an inherent dysfunction in the thyroid gland itself. In fact, if the immune system would just leave the thyroid gland alone, it could produce thyroid hormone just fine, and you wouldn't have these symptoms. So the medical standard of care simply provides extra thyroid hormone instead of actually fixing the problem. Beyond the major cause of hypothyroidism, there are actually 20 different patterns of physiological dysfunction that can lead to hypothyroidism. 5 of these patterns occur in the brain and include deficiencies in neurotransmitters like dopamine and serotonin, as well as elevated levels of cortisol, prolactin, and inflammation. Several patterns revolve around liver function and can be impacted by decreased levels of certain nutrients or even frank liver pathology. And of course, the gut plays a major role in many thyroid patterns, including autoimmune Hashimoto's and conversion of one thyroid hormone type to another. As you can see, most of these patterns have nothing to do directly with the thyroid, so throwing extra thyroid hormone at them doesn't address the problem, doesn't address the cause, and won't alleviate your symptoms. Depending upon which of the patterns that your testing reveals you're suffering from will determine whether or not you need to remain on a thyroid hormone replacement medication. Some patterns do require continued medication to make up for the thyroid hormone that's not being made. The care plan only begins there, however. Careful attention still must be paid to the underlying patterns that are present. They must be addressed properly in order to fully support proper physiological function and to allow your thyroid to operate as well as possible, giving you the best chance for improvement in your quality of life. When taking medication as part of your treatment from your medical doctor, you want to make sure that the particular medication is not actually making your symptoms worse by further exacerbating the underlying physiological dysfunction. Remember that for most hypothyroid patients, the main cause is Hashimoto's, the autoimmune disease. A major factor that may trigger and worsen autoimmune disease is a protein in foods called gluten. You may have heard about it being in foods like breads and pastas, and it's also found in personal care products like shampoo and toothpaste and lip balm, and it's under the guise of clever alternative names that you might not recognize. Unfortunately for many thyroid sufferers, it's also hidden in many medications, including some thyroid medications. So picture this, you have low thyroid, your doctor gives you thyroid hormone medication, you take the medication. It doesn't actually fix the underlying problem, the autoimmune disease. Not only does it not fix the problem, but it's actually making the problem worse because it has gluten in it. So you ingest the gluten in the medication and it causes an immune flare-up that drives your immune system to further attack your thyroid, destroying your ability to make thyroid hormone, creating a greater need for more medication. It's a very vicious cycle in which the very thing that you think is helping you is actually making things much, much worse. Therefore, it's very important that you first find out if you are sensitive to things like gluten, but also find out if your thyroid medication contains it. If it does, there are certain companies that make thyroid medication that's very clean and pure, free of any nasty fillers like gluten. It would be important to determine what medications will be best to help your progress, not hinder it. If you have thyroid symptoms and you want to know how I can help you identify if your medication is potentially making your problem worse, contact my office today at the number below to schedule a consultation to see if you qualify for care. Thank you and have a great day.